Global warming is one of the most serious health threats we face today. As the planet heats up due to the burning of fossil fuels, we are experiencing more frequent and intense heat waves that can have deadly consequences for our health. In this section, we will explore how global warming increases the risk of heat-related illnesses and deaths. Heat-related illnesses are conditions that occur when the body cannot cool itself properly. They include heat cramps, heat exhaustion, heat stroke, and hyperthermia. Heat stroke is the most severe form of heat-related illness and can cause organ damage, brain damage, or death. Heat-related illnesses can affect anyone, but some people are more vulnerable than others. These include children, pregnant women, older adults, outdoor workers, athletes, and people with chronic diseases such as heart disease, diabetes, or respiratory problems. According to a recent study published in Nature Climate Change, more than a third of heat-related deaths between 1991 and 2018 can be attributed to human-induced climate change. The study analyzed data from 732 locations in 43 countries and found that climate change increased the mortality risk associated with heat exposure in every continent. The study estimated that 37% of all heat-related deaths are attributable to climate change, which translates to about 9,700 deaths per year globally. The proportion of heat-related deaths attributed to climate change was highest, greater than 50%, in Southern and Western Asia, Southeast Asia, and parts of Central and South America. The study also projected that the number of heat-related deaths will continue to rise as global temperatures increase. The researchers warned that without urgent action to reduce greenhouse gas emissions and adapt to extreme heat, millions of lives could be lost in the coming decades. They also emphasized the need for more research on the health impacts of climate change in different regions and populations. The effects of global warming on our health are not something that will happen in the future, they are already happening now. We need to act fast to prevent further warming and protect ourselves and our communities from the dangers of extreme heat. We can do this by reducing our carbon footprint, supporting clean energy sources, improving our health systems, and increasing our resilience to heat stress. By doing so, we can save lives and ensure a healthier future for ourselves and our planet. Global warming is not only affecting the temperature of our planet, but also the health of its inhabitants. One of the ways that global warming affects our health is by increasing the risk of infectious diseases and allergens. In this section, we will explore how global warming influences the spread of these health threats and what we can do to protect ourselves. Infectious diseases are caused by microorganisms such as bacteria, viruses, parasites, and fungi that can infect humans and animals. Some of these diseases can be transmitted from animals to humans, such as rabies, anthrax, and plague. These are called zoonotic diseases. Other diseases can be transmitted by vectors, such as mosquitoes and ticks, that carry pathogens from one host to another. These are called vector-borne diseases. Examples of vector-borne diseases include Lyme disease, West Nile virus disease, dengue fever, and malaria. Global warming affects the spread of infectious diseases in several ways. First, it alters the habitats and behaviors of animals and vectors, increasing the chances of contact with humans. For example, as the climate changes, some animals may migrate to new areas or invade urban spaces in search of food and water. This can increase the exposure of humans to zoonotic diseases carried by these animals. Similarly, as the temperature and precipitation patterns change, some vectors may expand their geographic range or reproduce faster. This can increase the transmission of vector-borne diseases to humans. Second, global warming affects the survival and virulence of pathogens, making them more infectious or resistant to treatments. For example, higher temperatures and humidity can enhance the growth and survival of bacteria and fungi in the environment. This can increase the risk of infections from contaminated water, food, or air. Higher temperatures can also affect the immune system of both hosts and pathogens, making them more susceptible or aggressive. For example, some studies have shown that higher temperatures can reduce the effectiveness of vaccines and antibiotics. Third, global warming affects the social and environmental conditions that influence the spread of infectious diseases. For example, extreme weather events such as floods, droughts, storms, and heat waves can disrupt the infrastructure and services that provide clean water, sanitation, healthcare, and shelter. This can increase the exposure of humans to pathogens and reduce their access to prevention and treatment. Moreover, global warming can exacerbate poverty, malnutrition, displacement, and conflict, which can increase the vulnerability of populations to infectious diseases. Allergens are substances that can trigger allergic reactions in some people. These reactions can range from mild symptoms such as sneezing, runny nose, and itchy eyes to severe symptoms such as asthma attacks and anaphylaxis. Some of the common allergens include pollen, dust mites, mold spores, animal dander, insect venom, and food. Global warming affects the spread of allergens in several ways. First, it increases the production and distribution of pollen from plants, trees, grass, and weeds. For example, higher temperatures and carbon dioxide levels can stimulate plants to produce more pollen or to produce pollen earlier or later in the season. This can extend the duration and intensity of pollen seasons and expose more people to pollen allergens. Second, global warming increases the growth and dispersal of mold spores and dust mites in indoor and outdoor environments. For example, higher temperatures and humidity can create favorable conditions for mold spores and dust mites to thrive in buildings or natural areas. This can increase the exposure of humans to these allergens. Third, global warming affects the sensitivity and response of humans to allergens. For example, higher temperatures can increase nasal inflammation and airway hyperresponsiveness, making people more prone to allergic reactions. Higher temperatures can also interact with other air pollutants such as ozone and particulate matter, which can worsen respiratory symptoms and asthma. In conclusion, global warming is a serious threat to our health as it increases the risk of infectious diseases and allergens. To protect ourselves from these health threats, we need to take action to reduce greenhouse gas emissions and mitigate climate change. We also need to adapt to the changing environment by improving our surveillance, prevention, and treatment of infectious diseases and allergies. How global warming impacts mental health and well-being. Global warming is not only a threat to our physical health, but also to our mental health and well-being. In this section, we will explore how climate change affects our psychological state, both directly and indirectly, and what we can do to cope with the challenges. Direct impacts of climate change on mental health. One of the direct impacts of climate change on mental health is the exposure to extreme weather events, such as heat waves, floods, droughts, storms, wildfires, and landslides. These events can cause trauma, injury, displacement, loss of loved ones, property damage, and disruption of livelihoods. According to a report by the World Health Organization, WHO, up to 54% of adults and 45% of children suffer from depression after a natural disaster. Other common psychological responses include anxiety, post-traumatic stress disorder, PTSD, grief, guilt, substance abuse, and suicidal thoughts. The mental health impacts of climate change are not equally distributed among different groups of people. Some factors that make people more vulnerable to psychological distress include lower socioeconomic status, pre-existing mental health conditions, lack of social support, living in risk-prone areas, and having limited access to health care and recovery resources. Moreover, some populations are more exposed to the effects of climate change due to their geographic location, occupation, or cultural practices. For example, indigenous communities, farmers, fishers, and coastal dwellers may face more severe threats to their identity, culture, and livelihoods as a result of environmental degradation. Indirect impacts of climate change on mental health. Another way that climate change affects our mental health is through indirect exposure. This means that we may experience psychological distress even if we are not directly affected by a disaster or a hazard. For instance, we may feel anxious or depressed when we read or watch news about the worsening state of the planet or the future risks of climate change.